Hello, welcome to PCS Coding for Medical Surgical Related Procedures. I'm Mrs. J, and I am ecstatic to be here with you today. Let's begin by talking about the learning objective. Yeah, and there's only one. Number one, provide instruction on PCS coding. And specifically, we will discuss coding medical surgical related procedures, and we're going to practice medical surgical related scenarios. All right, coders, let's get started. Previously, we learned about the PCS code, specifically characters of a PCS code. And we first began discussing in part one, the medical and surgical section. That's the medical and surgical section of the book. We learned that of the seven characters, that first character describes the section in the book. And we also learned that when that first character letter is 0, you know you're coding from the medical surgical section of your book. So, congratulations. You've graduated. And now we will begin learning about the medical surgical related section. All right, so you might ask, what is the medical surgical related section? Well, here it is. Looks familiar, right? Yes, this section right here, values 1 through 9, they are the medical surgical related section. So I just want to call out everyone by name. If the value is 1, then it's obstetrics. We're coding for obstetrics. The value's 2, placement. 3, administration. 4, measurement and monitoring. 5, extracorporeal assistance and performance. 6, extracorporeal therapies. 7, osteopathic. 8, other procedures. 9, chiropractic. All right, coders, let's begin with our discussion on obstetrics. And you know that the value is 1. And anytime you see that 1, you know you're coding for the obstetrics. All right, so let's take a look at the code. Let's look at obstetrics PCS code. We know that every time it's an obstetrics procedure, the first value will be 1. Yes, 1. The second is going to represent a body system. 3rd, your root operation. 4th, body part. 5th, approach. 6th, device. And 7, qualifier. In fact, this looks very much like a medical surgical PCS code. Other than that 1, it is. All right, so let's get started and let's talk about coding for obstetrical procedures. All right, so let's begin and let's start with the character meanings page. And remember, the character meanings page is right before or precedes the obstetrics tables. All right, you cannot code from this page, but it is a great tool to see everything at a glance. So I'm going to give you some instruction right from this section. So the first thing that we see that this obstetrics, the code series, begins with 1, 0, 2. So that 1 tells us this is the obstetrics section. All right, the next value will tell you the body system. Yeah, so that 0, the second character tells you the body system. And it's also here and also at our, if you're referencing our PCS code, you can see it there. Now, see the green box? The green box says that our body system will be pregnancy. Yes, That is a body system in this case. And then the third character will be represented by, right here, you can see all of the root operations, your third character, your root operations are here. So when you're coding from the obstetrical section, you're going to code for your root operation change, the root operation drainage, abortion, extraction, delivery, insertion, inspection, removal, repair, reposition, resection, and transplantation. Yes, so these are the only root operations that you'll be coding for in the obstetrical section. Next, let's look at the body part. The body part, there are three. And in this chapter, you are only going to code for products of conception or products of conception retained or products of conception ectopic. Okay, coders, hold tight. We're going to talk about when we're going to define what products of conception is. But next, let's go and let's look at our approach. We've got the open approach, percutaneous endoscopic, via natural or artificial opening, via natural or artificial opening endoscopic, and external. And your sixth character, your device. Remember, devices are things that are going to remain in or on the body after the procedure. So 3 will be monitoring electrode, Y, other device, or Z, no device. And 7, you have a ton of qualifiers. We won't go through them all, but I'll just mention that this 0, high, is used typically for the C-section incision. 1, low, also the incision, a low incision. An extraperitoneal, that is where the incision is for the C-section, or it could be used in other places, but typically it is. And then 3, 4, and 5 are your forceps for forceps deliveries. 6 is vacuum, 7, internal version, 8, other, fetal blood or manual, A, fetal cerebral spinal fluid, and so forth. You get the picture, coders. All right, now we've spoken about all of the values of an obstetrics PCS code. Now let's go ahead and let's define products of conception. Remember, the products of conception is what you'll be coding for. Yes, and what is a product of conception? Well, that refers to all components of the pregnancy, including the fetus, embryo, amnion, umbilical cord, and placenta. So that's what you're coding for. And then next, the products of conception retained. These are products of conception that remained in the uterus after a spontaneous pregnancy or fetal tissue or pregnancy termination and even delivery. And finally, products of conception ectopic. These are products of conception that relate to an ectopic pregnancy. All right, so in other words, products of conception is any tissue caused by or related to the pregnancy. So that's what you're coding for in the obstetrics section. All right, so now that we've gotten out of the way what we code for, this term extraction. The term extraction is used when you are coding for a C-section or a vaginal delivery with assistance. Okay, so C-sections and vaginal delivery with assistance, and delivery root operation will be coded for a normal vaginal delivery. Now I'm going to step back for a moment and just let's process a delivery. All right, previously, prior to PCS coding, a delivery to me was a C-section or a vaginal delivery. But if you think about the objective of a procedure, think about, what is the objective of a C-section? Is the objective to pull pull out a baby? Or is the objective to pull or strip out all or a portion of a body part by the use of force? Absolutely. Absolutely. The physician makes the incision, then pulls the baby out. Okay, it's a lot more, there are a lot more steps involved, but that's exactly what's happening. So this is where knowing the objective comes into play. Also, when I say vaginal assistance, I'm talking about when the doctor has to help with the delivery. Yes, the doctor may need to apply forceps, may need to use a vacuum or other device to help with or facilitate that delivery. And if that's the case, that is coded to root operation extraction. Now, delivery, the doctor is pretty much, now let's say it's a normal delivery. The doctor is just pretty much standing there, letting the patient do all of the work. I'm just kidding. Well, the patient does do most of the work. The patient actually delivers the baby, and the doctor is there to receive the baby. So it's coded to delivery. All right, coders, I think we're ready to, well, not quite. I'm not ready to move on. So if we said that the body part that's being operated on or involved is products of conception, products of conception retained, and products of conception of an ectopic pregnancy. And these are all tissue caused by or related to the pregnancy. Now, what if a patient has other procedures that are not considered products of conception? An example, let's say that a patient has an episiotomy. Yeah, let's say the doctor has to incise the perineum so that the baby, to make way for the baby. Then that is coded separately, all right? So right here at the bottom, if a procedure is performed on a body part of a pregnant female, you code from the medical and surgical section assigned rather than from the obstetrics section. So if it's performed on a body part other than the products of conception, go ahead and code from the medical surgical section. And if you have an episiotomy, you will need to code from another section, and I'm going to show you where to code from. But now I want to take a look at these root operations that are common when coding obstetrics. All right, so change. Change is defined as taking out or off a device from a body part and putting back in an identical or similar device in or on the same body part without cutting or puncturing the skin or a mucous membrane. Drainage is taking or letting out fluids and gases from a body part. Abortion is artificially terminating a pregnancy. Extraction is pulling or stripping out of off all or a portion of a body part by the use of force. Delivery is assisting the passage of the products of conception from the genital canal. That is exactly what a delivery is. Now remember, coders, that's a normal delivery. Anytime that doctor has to help using force, let's say forceps or vacuum, then you're coding to extraction. Next, insertion. This is putting in a non-biological appliance that monitors, assists, performs, or prevents a physiological function, but does not physically take the place of a body part. Inspection. This is visually and or manually exploring a body part. removal, taking out or off a device from a body part, region, or orifice. Repair, this is restoring to the extent possible a body part to its normal anatomic structure and function. Reposition, this is moving to its normal location or other suitable location, or, all or a portion of a body part. Resection. Resection means cutting out or off without replacement all of a body part. And finally, transplantation. This is putting in or on all or a portion of a living body part taken from another individual or animal to physically take the place and or function of all or a portion of a similar body part. Okay, coders, so these are your root operations for obstetrics, and your first value, the section, is 1. And remember, we're coding products of conception. And products of conception, any tissue caused by or related to the pregnancy. All right, coders, I think you are ready. So let's get started and let's code for the delivery. All right, so our exercise says vaginal delivery with episiotomy. All right, coders. And again, coders, if you want to go ahead and pause and solve it, go right ahead. All right, the root operation. Well, first off, we've got 2 procedures here, so we're going to code both separate. So the first procedure is the delivery, so the root operation will be delivery. And what do? Of course, we look up the term delivery in the index, and then we scroll down for our type of delivery. So it doesn't say that this is a delivery that was complicated or anything. So we've got 2 options here. This is products of conception. That's what I would go for. Now, if the doctor manually assisted, you use the same code. All right. So the code is 10E0XZZ. You know what, coders? That looks like the entire code, and it is. So let's go to the corresponding table. 10E obstetrics, pregnancy, delivery, and let's look at this definition. And the definition is also the objective. The objective is to assist with the passage of the products of conception from the genital canal. And you know what, coders? I believe that's what happened. So our 4th character, okay, there's our code, but our 4th character is products of conception. The 5th is external. And pay attention, coders. This approach is external because the definition, it meets the definition, and this is passing through mucous membrane. So we'll go back and we'll review that definition, but this is definitely correct. And your device is Z, and your qualifier is Z, and that gives you the code 10E0XZZ. And in a moment, I'll explain to you why this approach character 5 is external and not going through a natural body part. Now it's time to code the second portion of this procedure. We coded first the delivery, and now we have to code for the episiotomy. What is your root operation? Some of you might say, well, this is kind of difficult. I don't know. You know what? You can just go ahead and look up the term episiotomy in your index. All right? Now, some people might already know that an episiotomy is division, and some of you may not. But just so you know, Division is cutting into a body part without draining fluids and or gases from the body part in order to separate or transect a body part. That makes sense. They are separating or transecting the perineum so that the baby can pass. All right, so let's go ahead and let's look up episiotomy in the index, and here it is right here. It tells you C division, perineum, female, and it takes you to your code 0W8N. So it says C perineum, so I'm going to do that and look at that. Division, perineum, female, and we get the entire code. All right, coders, even though we have the whole code here, you're not supposed to code from the index. However, you can code independently from the tables. So unlike ICD-10-CM, you can code directly from the tables, but it's not recommended to code from the index. And although it gives us the full code, and because we're learning, we're going to do things the correct way. We're going to go verify according to the corresponding table, 0W8. This is the code for medical and surgical anatomical regions or general. See that, coders? This is not a specific body part. This is an anatomical region, the perineum. And then division. And that is 0W8, our first three characters. Our fourth character body part is perineum. Fifth, external. Sixth, no device. Seventh, no qualifier. So our code is 0W8NXZZ, and if we're to code vaginal delivery with episiotomy, our first code will be 10E0XZZ, and our episiotomy 0W8NXZZ. Now, before we leave this scenario, I do want to point out why this is coded to the external. Here is the external approach, that is fifth character. The external approach definition is procedures performed directly on the skin or mucous membrane, and procedures performed indirectly by the application of external force through the skin or mucous membrane. So this is procedure directly on the mucous membrane. And if this were a C-section, we would also, no, we would not code it using that, but just to let you know, if the doctor had to apply force, not C-section, excuse me, but use forceps, this would also be coded to external. All right, coders, so if you got that correct, outstanding. All right, you ready for another one? I am. Okay. Low transverse cesarean section. So go ahead and pause to solve it. Okay, what is your root operation? If you said extraction, outstanding. So you know what we do with our root operation, we look it up in the in the index, and let's go ahead, look it up in the alphabetic index. Extraction, and then extraction of what? Extraction of products of conception. And you know what? There's no code there, so that means we need to be more specific. So let's go down and boom, low. Yes, low. 10D00Z1. That means it was a low incision. That's where they extracted the infant from. So our code, our first three characters is 10D. Let's go and find that corresponding table. And remember, coders, these tables are classified according to the section in alphanumeric order. So we are in the obstetric section, number 10D, and this extraction, the objective of an abstraction is pulling or stripping out or all of a portion of a body part by the use of force. And that's exactly what happened. They pulled that baby out. That is force. So our first three characters, 10D, our fourth character, products of conception. Our fifth, open. Sixth, no device. And our seventh character, that's low. And that will be a 1. So our code is 10D00Z1. And coders, if you got that correct, outstanding. All right, I got another exercise for you. This is laparoscopic assisted vaginal hysterectomy. All right, what is our root operation, coders? I didn't fool you, did I? No. Well, first, we need to figure out what this procedure is. This is a vaginal hysterectomy. This isn't a delivery. So we are not going to be coding from the obstetrics section because this is not a procedure carried out on products of conception. No, this is the body, the female's body. So we're going to code from the medical surgical section. All right. So with that said, what is the root operation? A vaginal hysterectomy. And if you said resection, outstanding. And then let's think about the body part. What is a hysterectomy? Hysterectomy is resection of the uterus. And let's go ahead and let's look up our root operation. Resection of the uterus. And it takes us to table 0UT with that fourth character 9. 0UT. Medical and surgical section, female reproductive system, resection. And the definition of resection, or the objective of a resection, is cutting out or off without replacement all of a body part. And that's indeed what happened. That uterus was totally removed without replacement, the entire uterus. All right, so let's look for our fourth character body part. And if you go down, there's your uterus. 9, the approach. And you know what, coders? I just want to reiterate that you have to stay in your lane. So your 5th, 6th, and 7th has to come from the very same lane as the 4th. All right, so of the 4 approaches or 5 approaches, is it open, percutaneous, endoscopic? Is it via natural or artificial opening? Is it via natural or artificial opening endoscopic? Or is it via natural or artificial opening with percutaneous endoscopic assistance? If you said via natural or artificial opening with percutaneous endoscopic assistance, that is correct. And let me explain. Although we know this patient had a vaginal hysterectomy, the laparoscope went through, that's a scope going through the abdomen, assisted with this hysterectomy. So F is correct. And if you said F, outstanding. Our next 2 values, the 6th character device, there's no device, and the 7th character will be no qualifier. The only way we would be able to select anything else is if it was indicated in the documentation. There's no mention, so there is no, we're not going to consider it. All right, so our code will be 0UT9FZZ. Okay, coders, if you got that correct, outstanding. Now it is time to move on. We've finished our discussion of obstetrics. Now it's time to talk about placement. What is placement? Well, we do know that if we are coding for placement, the value is 2. So we're going to define what placement is, but before we do that, let's take a look at a placement code. All right, so we know that the section is 2. And when we compare it to a standard medical surgical PCS code, the only difference is instead of saying body part, we use the term body region. And I'm going to go back, and it's in green. And from here on out, whenever we are looking at the codes according to each section, the green will represent language or the difference between this code and a medical surgical code. All right, so let's go and let's look at placement. Let's define what placement is. Okay, so we know the section is 2, and we know the body system is the second character. The second character here are W and Y. W is for anatomical regions, and Y will be anatomical orifices. Okay, now well, let's go ahead and define what placement is. We're talking about it, but we didn't define it. Placement include only those procedures that are performed without making an incision or a puncture. Example, placing on a bandage, a cast, etc. Okay, so now let's look at our root operations for the anatomical regions. The root operations will be change, compression, dressing, immobilization, packing, removal, and traction. And then your body regions will be your head, face, neck, abdominal wall, chest wall, back, inguinal region, right, left, upper extremity, right, left, upper arm, right, upper arm left, lower arm right, right hand, right thumb, right finger, lower extremity right, left, upper leg right, upper leg left, lower leg right, lower leg left, right foot, right toe, left toe. Okay, that was a mouthful. All right, so those are your body regions. Next, you only have one approach. It's external, and then you've got devices. I think this is one of the few times that we are using the devices. All right, the sixth character, the device. If it's a traction apparatus left on or in the body, a 0. A splint will be 1, cast, 2, brace, 3, bandage, 4, packing material, 5, pressure dressing, 6, intermittent pressure device, 7, wire, 9, other device, Y, Z, no device. All right, and our seventh character is Z. That's easy. So these are all the characters or values for your anatomical regions. Now let's take a quick look at the anatomical orifices. All right, your root operations are change, packing, removal. Your body orifice, your mouth and pharynx, 0, nasal, 1, ear, 2, 3, anorectal, 4, female genital tract, 5, urethra. And next, your approach will always be external. Your device will always be 5, packing material, and 7, no qualifier. All right, so now let's just take another look at these root operations and their definitions. And I'm doing this because we're learning. And the more you see it, the more the better you'll get it. It will come, I promise. All right, so for placement, value 2, that's your section. Changes, taking out or off a device from a body part and putting back an identical or similar device in or on the same body part without cutting or puncturing the skin or a mucous membrane. And you know what, coders? We're going to learn guidelines later, but I do want you to know that I will be pointing out certain guidelines as they present themselves, but you don't have to remember them. The most important thing that I want you to do is to understand how just to perceive these definitions and how to perceive these or the objective of these procedures. All right? All right. Compression. This is putting pressure on a body region. And coders, remember, anytime you have anytime you want to use any of these definitions, every last bit of it has to fit, not part of it. Okay, so let's go back to change. Taking out or off a device from a body part and putting back an identical or similar device in or on the same body part without cutting or puncturing the skin or a mucous membrane. Coders, if you're taking out a device from a body part, you have to put back an identical or similar device. There's no negotiation. It must be identical or similar, and on the same body part. And you can't cut or puncture the skin or mucous membrane. All of the elements of that definition has to be met. All right, I digress, but I'm going back. All right, so we left off at compression, that's putting pressure on a body region, and dressing. Dressing is putting material on a body region for protection. Immobilization, limiting or preventing motion of a body region. Packing, putting material in a body region or orifice. Removal, taking out or off a device from a body part. Traction, exerting a pulling force on a body region in a distal direction. Okay, coders, these are all your root operations for placement. Do you remember what placement is? Sometimes I forget too. And placements include only those things or those procedures that are performed without making an incision or puncture. All right? So now that you know the root operations, let's go ahead and let's do our exercise. Packing of chest wound. Now this is a little different, coders. You know how we use those 31 root operations? Well, for medical surgical section, I'm pointing out your root operations. So I've just shown you what the root operations are for placement. So you have to select one of these root operations, or you should, to code for packing of a chest wound. And if you look at this image on the upper right, of the 7 root operations, which will you choose? If you said packing, outstanding. Packing will be your root operation. There you go. So we're going to look in our alphabetic index. We're going to look up packing. Packing what? Packing chest wall. And you know what? It gives us the entire code, 2W44X5Z. We're going to go find that corresponding table, 2W4. And this is placement, anatomical regions, packing. And the definition or objective of packing is putting in material in a body region or orifice. And that's exactly what's happened. They packed some material in the chest wound. So let's go ahead and let's finish out our code. The alphabetic index says that the 4th character shall be for chest wall. I agree. And if you don't really trust it, since you're learning, let's look down and see. if there's any better code. And you know what, coders? Chest wall is it. And the next character will be approach. The sixth character is packing material. And you know, a device is that thing that's left in or on the body after the procedure. That packing remained in that chest wound. And our seventh character is Z, no qualifier. And our code 2W44X5Z. Okay, coders, how do you feel? Are you ready for the next exercise? Okay, if you got that correct, outstanding. Removal of splint right shoulder. Okay, coders, what is your root operation? I'm going to give you a hint. There you go. If you said your root operation is removal, outstanding. Okay, so we're going to look up removal in our alphabetic index. Then we're going to remove what? What are we removing from? This is the right shoulder. So the shoulder is a part of the arm. It's a part of the upper arm, and it's right. And you know what, coders? The code provided is 2W5AX. So our next task, let's find that corresponding table. 2W5, placement, anatomical regions, removal. This is taking out or off a device from a body part. That's exactly what happened. They took that splint off. The splint is a device, and they took it off of the body part. All right, so our index tells us that the next code, the next value will be A. So let's look for A. There it is, upper arm right. How specific is that? The next code is value is external. The sixth character is splint, 1. The seventh is Z. And coders, our final code, 2W5AX1Z. And if you got that correct, outstanding. All right, so we've graduated. We know how to code for section 2. It's time to move on to section 3. And this section is administration, and you'll see the value 3 in the section portion of the PCS code. And let's take a look at the actual code. We know the first value is a 3, and we also see in green that there is body or body system, body region. That's how they refer to that area. And also we see a difference in your device. There's no device. It's a substance. Yes. So that's the substance used in or on the body. All right, so let's look at our character meanings page to do our study. We see that the administration begins with 3. We know we're in the correct location. And our second character, 0. And then when you see a 0, that's for the circulatory system, or circulatory, that's our body system that we are coding for. And also, we have an indwelling device. That's our body system. And we have a third one. There are 3. You've got your physiological systems and anatomical regions. She'll be coding for 3 different body systems. Now, let's go ahead, and right here on the right, you'll see you got your 3 body systems. I've documented them for you. 0, CE, 0's for circulatory, C is for indwelling device, and E is physiological systems and anatomical regions. Now let's look at each separately, and we'll start with circulatory. If you look at the character meanings page or table, The circulatory is only dealing with a transfusion, all right? And that's your second character. Excuse me, your third character is your transfusion. This is your root operation. Your fourth character, or your body systems or body regions, will be your peripheral vein, central vein, peripheral artery, central artery, products of conception, circulatory, and vein. Oh, you know what, coders? I didn't define what administration is. So let's backtrack a little bit. Administration, these are injections, infusions, and transfusions. All right? That's all it is. Okay, so let's go back. So if we're talking about circulatory, that's only going to be dealing with transfusions. And make sure you look up the definition or the objective of a transfusion. And I'll just say it. This is putting in or on all or a portion of a living body, transfusion. A transfusion only deals with blood, putting in blood or blood products. So I apologize for that. Now let's go on. All right, so if we're just talking about blood or blood parts or products, where the root operation will be transfusion, and your body, your fourth character body system or body region will be your peripheral vein. This is where they're putting it. Central vein, peripheral artery, central artery, products of conception, circulatory, and vein. Your approach, you've got three approaches: open, percutaneous, or via natural or artificial opening. This is how the doctor approached this procedure. Your substance, this is the substance that you're putting in or on the body part: stem cells, embryonic, 4-factor prothrombin complex concentrate, bone marrow, whole blood, serum albumin, frozen plasma, fresh plasma, plasma cryoprecipitate, red blood cells, frozen red blood cells, white cells, platelets, globulins, fibrinogen, antihemophilic factors, factor 9 or IX, stem cells or cord blood, and stem cells hematopoietic. And then your seventh character, autologous, non-autologous, allogeneic, related, allogeneic, unrelated, allogeneic, unspecified, and Z, no qualifier. So these are all of your values for circulatory administration. Next, indwelling device. We've only got one. This is irrigation, and that is your root operation for irrigation. Your body system or region will be Z. Your approach is X. Your sixth character, your substance that's left in the body, will be irrigating substance, and then your seventh character, that will be no qualifier. Now let's look at the final. This is our physiological systems and anatomical regions. Coders, I will not read all of these. You know, you won't remember them. But just to give you an idea, the root operation will be introduction or irrigation. We know what introduction is. That's often going through the skin. We know what irrigation is. That's washing out. Your body system and your region, just take a look. You see your skin, mucus and membranes, your subcutaneous tissue, muscle, peripheral veins, central veins, etc. Your approach are as follow. You have open approach, percutaneous endoscopic, via natural or artificial opening, via natural or artificial opening, endoscopic, and external. And your sixth character substance that remains in or on the body: anti-neoplastic, thrombolytic, anti-infective, anti-inflammatory, serum toxoid vaccine, adhesion barrier, and so forth. Your seventh character qualifier Autologous or influenza vaccine. See how specific this seventh character is? Non-autologous, high dose, interleukin, low dose, interleukin, liquid bradytherapy, radioisotope, other anti-neoplastic. All right, coders, let's get started. These are your physiological symptoms and anatomical regions, body systems, and their values. Now let's take a look at the values, the common values between all three for administration. It's just three. You have value 0 for introduction procedures, value 1 for irrigation procedures, and value 2 for transfusions. Now let's go ahead and read their meanings, these root operation meanings. Introduction is putting in or on a therapeutic, diagnostic, nutritional, physiological, or prophylactic substance except blood or blood products. So you don't use introduction for blood. Irrigation, putting in or on a cleansing substance. And finally, your transfusion, putting in blood or blood products. That's it. All right, coders, these are your root operations for administration, value, section, value 3. So let's get started. Now let's review what is the root operation for peritoneal dialysis via indwelling catheter. Now remember, coders, I told you those 3 root operations. So let's review them together so you'll just know. So if you want to know what the root operation is, you got to ask yourself, what is the objective of the peritoneal dialysis? And that objective is, of the 3, the objective is irrigation. Yeah, that's exactly what it's doing. It's not a transfusion because it's only blood. An introduction, that's putting in or on a therapeutic, diagnostic, or nutritional, physiological, or prophylactic substance, except blood or blood products. All right. And I'm going to show you why the root operation is irrigation in a moment. But let's go ahead and look it up. The root operation, irrigation, irrigation. Where? Peritoneal cavity. Yeah. Dialysate. That's what they're using to clean out that body part. And they give you the code 3E1M39Z. So let's go ahead and verify it on our tables. Our corresponding table, 3E1, administration. Physiological systems and anatomical regions, root operation irrigation, you're putting in or on a cleansing substance. And here you go, peritoneal cavity. Your 4th character is M. Your 5th character is percutaneous. Your 6th is dialysate. And your final character, well, you know what? It's Z. That's all we have. It's no qualifier. And you know what? Our code, 3E1M39Z. All right, coders, that one may have been a little tricky. How did you do, coders? If you got it correct, outstanding. We have another exercise. Yes, this is for administration of total parenteral nutrition via central venous catheter. All right, coders, what is the root operations? And I've put them right in front of you. If you said that the root operation of this procedure is introduction, outstanding, because when parenteral nutrition is being administered, that's typically when someone has an ostomy and they are putting in food through their tube. So if you look at the definition or the objective, this is putting in or on therapeutic, diagnostic, nutritional. There you go. That's our key term. So we know that our root operation is introduction. All right. So what do we do first? We look up introduction in the alphabetic index. Introduction, in or on what? Vein. Yeah, it is a vein. See, central venous. Central. Yes, continued. Central. And central what? Nutritional substance. And it gives us the code 3E04. Let's turn to our tables and let's find the corresponding table. 3E0. This is administration, physiological systems, and anatomical regions. Introduction. This is correct. And let's look for our, okay, I knew it wasn't there. We had to scroll down a little more, and you see this little 3EO continued. Make sure you read your notations. And I went all the way down and I found my code. The central vein is my body system or region. My approach is percutaneous, but this is the section, this substance is really what told me that I needed to look further, because I needed to look for my nutritional substance, our sixth character and value 6, and the final character and the final value will be Z, and the code is 3E0436Z. All right, coders, how are you coming along? Okay, let's continue. And we're going to move on to the next section, section 4. This is for measurement and monitoring, section 4. Now let's take a look at the PCS code. We know the first character will be value 4, and we also see that character 4 is a body system, and that's pretty, no, it's not standard, but the fourth character is body system, and the sixth character is the function or device. And those are the differences between a standard medical surgical code and a measurement and monitoring code. So let's move on and let's take a peek at our character meanings page, and let's verify that we're where we need to be, and we are, because the section matches the measurement and monitoring for 4. That's your first character. Our second character is the body system. The body system is what? If you're looking, it is physiological systems. Now let's talk about the definition of measurement and monitoring. The definition is measurement and monitoring represents procedures that determine the level of a physiological or physical function. For example, EKG, Holter monitoring, etc. So these are things that measure your function, the physiological functions. So let's go back and let's take a look at the body systems. We have A, physiological systems, and there are 2, and we have physiological devices. So there's your physiological systems, there's your physiological devices. You got 2 body systems. So let's go back. And now the third character will be your root operation. Your root operations are, you got 2, measurement. It's either measurement or monitoring. Okay, so that's simple enough. The fourth body system will be either your central nervous, peripheral nervous system, cardiac, arterial, venous, circulatory, lymphatic, visual, olfactory, Olfactory, that's your smell, okay? So if you want to write it, you can. Respiratory, gastrointestinal, biliary, urinary, biliary, that's your liver, urinary, musculoskeletal, skin and breast, products of conception, cardiac, so we're talking about the baby's heart, products of conception, nervous system, that's the baby's nervous system, and Z, none. And we have the following approaches: open, percutaneous, endoscopic, via natural or artificial opening, via natural or artificial opening, endoscopic, or external. The function or device, character 6, these are things that are left on or in the body. Acuity, capacity, conductivity, contractility, electrical activity, flow, metabolism, mobility, motility, output, pressure, rate, resistance, rhythm, secretion, sound, pulse, temperature, volume, total activity, sampling and pressure, action currents, sleep, saturation, vascular perfusion. Qualifier 7. Central, peripheral, portal, pulmonary stress, ambulatory, right heart, left heart, bilateral, sensorial or sensory, guidance, motor, coronary, intracranial, other thoracic, intraoperative, endocyanine, green dye, no qualifier. All right, coders, so you're kind of getting the picture. I mean, if you're just looking at this, you might want to say to yourself, well, what else could be in this? Maybe a sleep monitor, sleep apnea monitor? I'm pretty sure it would fall under this. All right, coders, I don't want to digress. Let's get started and let's look at the root operations for measurement and monitoring. And measurement and monitoring are your root operations. First, let's define measurement. Measurement is determining the level of a physiological or physical function at a point in time. Okay, so time is key, a point in time. Next, monitoring is determining the level of a physiological or physical function repetitively over a period of time. And you know what? Some people might say, I don't understand that. They give you some examples. So an example of measurement, this is a function at a point of time. An EKG does that, and that's a good example of measurement. Now, monitoring, urinary pressure monitoring, that is an example. Now, a urinary pressure monitoring would be something like avoiding cystourethrogram, where they measure repeatedly, they do, the function of your bladder. So that's what a urinary pressure monitoring is. And ladies and gentlemen, these are your root operations for measurement and monitoring. Section 4. Now it's time, coders. It's time for your exercise. You ready? Cardiac stress test, single measurement. What's the root operation? It's either measurement or monitoring. If you said measurement, outstanding. Yes, it's in the language too. It's in the documentation. So let's go ahead and look up measurement, our root operation. Measurement of what? This is a cardiac stress test. Cardiac, let's go down, be more specific. Boom, total activity stress. That's what a stress test is. And it gives you the entire code for A0 to XM4. So our job is to look at the corresponding table, look it up, and it's 4A0, measurement and monitoring, physiological symptoms, measurement. This is the correct table. So let's see what the next character that's given is 2. I don't see it here. Let's go to the next page. There it is. We got a couple of 2s. And so sometimes when you see that, you might have to look over in the approach and the device to see your code. And ours happens to be right here. Cardiac, external, total activity, stress. That says everything. These are our keywords in our documentation too. And our code, I went a little too fast, is 4A0XM. All right, coders, if you got that correct, outstanding. I'm proud of you. Now we're going to move on and we're going to talk about Section 5. Section 5, extracorporeal assistance and performance. Let's take a look at the code. We know that first character or that first value of the code will be a 5. You've got a body system, root operation, another body system, duration, function, and qualifier. So 4th, 5th, and 6th characters are all different than a typical medical surgical code. And your first code, your first character, 5, value 5, will tell you that you're coding from extracorporeal or systemic assistance and performance. All right, coders, so what is extracorporeal or systemic assistance and performance? Let's go ahead because I keep forgetting to define it for you, but we do know we're in the correct section. The definition is these are procedures that use equipment to support a physiological function such as breathing, like a mechanical ventilation, blood circulation, like hemodialysis, or restoring the natural rhythm of the heart, like cardioversion. In fact, well, since we know that this section is 5, we know the body system is physiological functions, that's A. The root operation is either going to be assistance, performance, or restoration. Assistance is restoring or taking over a portion of the body, the function of the body part. Performance is completely taking over that function of the body part, and restoration restores the functioning of the body part. Your root operations are, your body systems, are cardiac, circulatory, respiratory, biliary, and urinary. I apologize. I'm getting a little ahead of myself. What I'm really trying to do is put my pointers up, and if I don't click it hard enough, you won't see it. The duration, your 5th character will describe the duration, the length that you are using these devices. You've got a single, intermittent, continuous, less than 24 consecutive hours, 24 to 96 consecutive hours, greater than 96 consecutive hours, multiple, intermittent, less than 6 hours per day, prolonged intermittent, 6 to 18 hours per day, and continuous. This is greater than 18 hours per day. Your 6th character, you got a function, your 6th character, and it could either be filtration, output, oxygenation, pacing, rhythm, ventilation. And finally, your 7th character qualifier. We've got some here. You've got your balloon pump, hyperbaric, manual, non-mechanical, pulsatile, compression, other pump, continuous positive airway pressure, intermittent positive airway pressure, continuous negative airway pressure, intermittent negative airway pressure, supersaturated, impeller pump, membrane central, membrane peripheral, venous, veno-venous, that's vein to vein, and Z, no qualifier. So this too, this is the actual, when I spoke earlier about the CPAP, that was the administration of that oxygen. This is actually where a CPAP would fall. Would it take over a portion of the body part, complete, or will it restore that body part? Let's go ahead and let's look at these root operations a little more careful. All right, so if you're going to code for assistance, assistance means taking over a portion of a physiological function by extracorporeal means. Performance means, and the example that they give you is hyperbaric oxygenation of a wound. Performance is completely taking over a physiological function by extracorporeal means. So that means that this machine is doing the work completely. So a cardiopulmonary bypass in conjunction with CABG, whenever they're carrying out that CABG procedure, you or the patient is going to need this machine to carry out the function of completely beating the heart for them. All right, so this performance is going to completely take over the functioning of that body part. Restoration. This is returning or attempting to return a physiological function to its original state by extracorporeal means, and that's attempted cardiac defibrillation, so cardioversion, so forth. Okay, coders, this is root operations for extracorporeal or systemic assistance and performance. And make sure you know the difference between assistance, that's a portion of the body part taking over a portion. Performance is completely taking it over. Restoration is restoring. All right, so here's our scenario. Mechanical ventilation, 16 hours. We've got 3 root operations. Is this assistance? Is this performance or restoration? What is the root operation? If you say performance outstanding, the mechanical ventilation is completely breathing for that patient 16 hours. So let's go ahead and look up our root operation, performance. Performance of what? Performance of respiratory. Yes, and we need to talk about, or we need to specify the length. How long? This documentation says 16 hours, so we're going to code less than 24 consecutive hours of ventilation. 5A1935Z. All right, coders, it gave us the full code, so let's go to the corresponding table. 5A1, extracorporeal or systemic assistance performance, physiological systems, performance. Definition or the objective of this mechanical ventilation should be completely taking over a physiological function by extracorporeal means. That is indeed what happened. So let's go find our respiratory, our 9 value. Which one are we going to use? Well, I'm going to take a peek over, and I see that they are listing in the duration on this row, so I'm going to code from that row. Okay, so our 4th character is 9. Our 5th character value will be 3 because it's less than 24 consecutive hours. Our 6th character will be ventilation, and 7th, the value for the 7th character will be Z, and our code is 5A1935Z. How'd you do, coders? Did you get that right? I know you did. Outstanding. All right, we've got another. We have liver dialysis, single encounter. We've got 3 root operations. Is it assistance, performance, or restoration? What is the root operation? If you say performance outstanding, and I'm going to tell you why, because liver dialysis involves well, no, I'll tell you on the next slide. How about that? But just work with me. If you didn't know, then I'll tell you on the next slide. All right, so your liver dialysis is performance. So we're going to look up performance, biliary, because biliary means liver, bili means liver, and single filtration, 5A1C00Z. Let's look up our corresponding table, 5A1 table. There you go, 5A1, extracorporeal or systemic assistance in performance physiological systems, because it took over completely that completely took over a physiological function by extracorporeal means, performance. Now our code in the index says that the next character is C. So let's see. Oh, there you go. It's only one C. And what is it, single or multiple? Our documentation says single. Our function, we only have filtration. And our 7th character, there's no 7th character qualifier. So our code will be in the lower left. 5A1C00Z. And if you got that correct, coders, outstanding. All right, so let me show you why liver dialysis is a performance and not assistance. Now, performance means completely taking over a physiological function by extracorporeal means, and assistance is taking over a portion of a physiological function by extracorporeal means. So if you think about the objective of liver dialysis, well, what is happening? You'll know that liver dialysis is a detoxification treatment, and this is for liver failure. So if the liver isn't working properly, you're going to need this dialysis to remove toxins, okay? Remove toxins. That's, your liver can't do it anymore because it's in failure. So you'll need the dialysis. And it works very similar to hemodialysis. So that's why it's performance. Remember the definition or the objective of performance. This is completely taking over a physiological function. So it didn't completely take over the liver, but it completely took over one of the functions, and that function is detoxifying. So that liver can't detox. All right. And that's just about it. So that liver can't filter. It cannot filter toxins, and it has failed. So that is one of the functions of your liver, and this dialysis has completely taken over that function. All right. So how many of you confuse this liver dialysis with hemodialysis? Yeah, that's very easy to do. So the hemodialysis works the same way. The hemodialysis is taking over the function. And don't code a hemodialysis like a blood transfusion, because it's not. Okay, so they are this dialysate, the dialysate, that cleanser is in this machine here. And once they pump the blood into the machine, it is cleansing that blood. and then putting it back into the body, and it is carrying out one of the physiological functions of the kidney. All right, so just so you know, you've got hemodialysis, and that's typically administered in a dialysis center or even in the hospital if the person's confined, and a peritoneal dialysis. Now, that could even be done at home. The difference, the hemodialysis is connected to typically your vein, a peripheral vein, and the peritoneal dialysis, it goes right into the peritoneum. All right. Did I digress? Maybe a little, but hopefully it helped you. Next, cardiac countershock with successful conversion to sinus rhythm. All right, coders, is it assistance, performance, or restoration? Which of the three is our root operation? If you said restoration, outstanding, because what the purpose or the objective of this cardiac countershock is to restore back to normal sinus rhythms, okay? So let's go ahead and look up our root operation, restoration. You know what? If you look that up, you only have one code, 5A2204Z. That is the code, and we're going to go find the corresponding table. 5A2, extracorporeal or systemic assistance and performance. Physiological systems, restoration. And if you need to confirm that definition, it is written here: returning or attempting to return a physiological function to its original state by extracorporeal means. Cardiac, single, rhythm, no qualifier, your code 5A2204Z. And we've got one more, coders. How did you do? You doing good? Outstanding. All right, coders. Intermittent positive pressure breathing, IPPB, for mobilization of secretions, 22 hours. What is your root operation? Is it assistance, performance, restoration? Your root operation is assistance. And you know how you know? This is intermittent positive pressure breathing. So the patient is doing the breathing. Yeah. Okay, so it's not completely taking over the body part, but it is taking over a portion, so it's helping it along. And let's go ahead and let's look up assistance in your alphabetic index. Assistance of what? Assistance of your respiratory system. And underneath that, go ahead and let's see what we are coding for. Intermittent positive airway pressure. That's exactly what happened. Is this our CPAP? Could be. Or our BiPAP? Could be. 5A09458. 5A0, extracorporeal or systemic assistance and performance, physiological systems, assistance. This is taking over a portion of a physiological function by extracorporeal means. Our fourth character is 9, respiratory. Our fifth character is 3 because this was less than 24 consecutive hours. Our sixth is 5 for ventilation. And our seventh character is value 8 for intermittent positive airway pressure. And the code 5A09358. All right, coders, how are you doing? Did you get that correct? Outstanding. I know you did. All right, let's move on. Now it's time to learn about Section 6. This is extracorporeal therapies. So what is that? Well, before I tell you what it is, I want you to see the difference between the codes. So this PCS code has the Section 6, your body system, your root operation. It's got the root system, duration, qualifier, and another qualifier. Looks very similar to the extracorporeal. It looks very similar to 5, System 5, Section 5, excuse me. All right, so we know we're in the correct section, Section 6, if in your PCS manual, you're in the extracorporeal or systemic therapy section. And what is it? This is, will pretty much describe other systemic procedures not defined by the root types, assistance, performance, and conversion, right? So basically, if it's not coded in Section 5, it's coded here. Okay, so that's an easy way to regard it. So let's get going and let's look at our second character. Our second character is body system. And our body system is physiological systems. That's it. Our third character, root operation. Our root operations, value 0 is atmospheric control. Value 1 is decompression. Value 2 is electromagnetic therapy. Value 3 is hyperthermia. Value 4 is hypothermia. 5, pheresis. 6, phototherapy. 7, ultrasound. 8, ultraviolet light therapy. 9, shock wave therapy. And B, perfusion. Our body system, skin, urinary, central nervous, musculoskeletal, circulatory, respiratory, hepatobiliary system and pancreas, urinary system, and none, or none. Character space number 1, section 6. When you see that 6, you are coding extracorporeal therapies. The PCS code for extracorporeal or systemic therapy, section 6, are your section, of course that's a 6, your body system, root operation, body system, duration, qualifier, and qualifiers. So for your 6th and 7th characters, you have 2 qualifiers. Now let's learn what extracorporeal therapies or systemic therapies are. So if you go to the character meanings table, we know we're in the correct table because the first character is a 6. Extracorporeal or systemic therapies describe other systems or other systemic procedures not defined by the root types, assistance, or performance. Yes. So it's pretty much, if it's not in section 5, it's right here. Okay, so let's take a look. Our body system for section 6 is 2. And if you look over, we have physiological systems. That shall be our body system. Our root operations, or third character, are atmospheric control, decompression, electromagnetic therapy, hyperthermia, hypothermia, pheresis, phototherapy, ultrasound therapy, ultraviolet light therapy, shock wave therapy, perfusion. Our body system. Fourth character will be skin, urinary, central nervous, musculoskeletal, circulatory, respiratory, hepatobiliary system and pancreas, urinary system, and none. Our duration, which is our fifth character, either single or multiple. The qualifier is either donor organ, no qualifier, and your seventh character qualifier, erythrocytes, leukocytes, platelets, plasma, head and neck vessels, heart, peripheral vessels, other vessels, stem cells, cord blood, stem cells, hematopoietic, and no qualifier. All right, coders, so let's take a closer look at our root operations and let's define them for you. All right, so here you go. System section 6. The root operation, atmospheric control. When we're speaking of atmospheric control, we're talking about extracorporeal control of atmospheric pressure and composition, like antigen-free air conditioning, series treatment. Decompression is extracorporeal elimination of undissolved gas from body fluids. Electromagnetic therapy is extracorporeal treatment by electromagnetic rays. Hyperthermia, extracorporeal raising of the body's temperature. Hypothermia, extracorporeal lowering of body temperature. Pheresis, extracorporeal separation of blood products. Phototherapy, extracorporeal treatment by light rays. Ultrasound therapy, extracorporeal treatment by ultrasound. Ultraviolet light therapy, extracorporeal treatment by ultraviolet light. Shockwave therapy, extracorporeal treatment by shock waves. Perfusion, extracorporeal treatment by diffusion of therapeutic fluid. And ladies and gentlemen, these are your root operations for extracorporeal or systemic therapies. And remember, coders, if it's not in section 5, then it is in section 6. And remember what section 5 is? This is your coding for assistance, performance, and restoration. All right, coders, are you ready for that first exercise? So, it's a short one. Donor thrombocytopheresis, single encounter. All right, coders, what is the root type? Here are your options. What is the root type? If you said pheresis, outstanding. You know what, coders? We have to use whatever device that we have. This pheresis, this root word, pheresis, was also found in thrombocytopheresis. So this is the correct answer. So let's go ahead and look up our root operation. Pheresis. Yeah, we're just going to look that up. Pheresis of what? We have erythrocyte, leukocytes, plasma, platelets, stem cells. Which one? If you said a thrombocyte is another name for platelet, thrombocytopheresis, that's another word or term for platelet. So we're looking up platelets. Platelets is 6A55. All right, coders. Now our job, find the corresponding table. 6A5, this is extracorporeal or systemic therapies, physiological systems, pheresis. And don't forget, the objective is extracorporeal separation of blood products. And we're in this, our body system is value 5, circulatory. Our 5th character, duration, is value 0, single. Our 6th character is Z. Our 7 is 2 for platelets. So our answer, 6A550Z2. So how'd you like that, coders? How'd you do? I hope you did good. I know you did good. And I'm going to tell you in advance, outstanding. We have another exercise. Whole body hypothermia, single treatment. All right. So is this when they put you in this chamber? This is a new weight loss fad. They put you in a chamber and you lose weight. They bring your body temperature down really low and you lose weight. I wonder if it works. Okay, next, what is your root type? What is the root operation? Coders, if you said hypothermia, outstanding. This is extracorporeal lowering of the body temperature. So our next step, we're going to look up that root operation, hypothermia. In the index, there it is, hypothermia, whole body. Your code, 6A4Z. There it is, 6A4, extracorporeal or systemic therapies, physiological systems, hypothermia. Your 4th character value is Z. Your 5th character value is single, because if you didn't know, I'm just referring to the documentation. And your 6th character qualifier is Z, and so is your 7th character. And your answer, 6A4Z0ZZ. Okay, coders. I think I read off the wrong answer before, but you get the picture, coders. You should have said 6A550Z2 for your pheresis. So I apologize for that. Yes, I am looking at 2 screens. You caught me. All right, so good job, coders. Outstanding if you got this correct. And it's time to move on to our next section. Character space 1, section 7 is osteopathic. Yes. And we have our section, our first character is section, 2nd body system, 3rd root operation, 4th body region. We have our approach, 6th method, and your 7th character will be your qualifier. All right, now let's go ahead and define what osteopathic procedures will represent. And well, first, we know we're in the correct section. We see that 7. So let's go ahead and define what osteopathic is. This pretty much defines the osteopathic method of a procedure. Now, what does that mean? Well, osteopathy is considered to be an alternative medicine. It's alternative medicine. You know, there are DOs, doctors of osteopathy. They take a more of a holistic approach to medical treatment and or medical practice. They have the same education as an MD. However, they take a more holistic approach. Specifically, people that practice osteopathy, They believe in the theory that many of the body's diseases are the result of disturbances in the musculoskeletal system that arise from abnormal or incorrect alignment of the bones, ligaments, and muscles. So they believe in that proper alignment. Yeah, have you ever gone on an inversion table? And that inversion table flips you upside down and it properly, you can even feel your spine properly aligning, and there's supposed to be some medicinal effect or some therapeutic, not medicinal, please forgive me, therapeutic effect of having that in proper alignment, and it's consistent with the osteopathic theory. Now, the goal of osteopathic treatment is to restore motion and balance into the musculoskeletal system, thereby allowing the body's natural healing elements to flow freely and return to the body while the toxic byproducts of the injuries are all drained away. So I think it's a really neat perspective. I have seen a DO and I didn't know it. An endocrinologist my endocrinologist was a DO. I had no idea. He gave me medicines too. He did not put me on the table. No, I'm kidding. But I do think he was more less willing to treat with medicine versus natural approaches. So that is good in itself. All right, so now we know what the osteopathic procedures are. The second will be the body system. The second character will be your anatomical regions. Your third, your root operation, you only have one, that's treatment. Your fourth will be body regions, your head, cervical, thoracic, lumbar, sacrum, pelvis, lower extremities, upper extremities, rib cage, abdomen. Your fifth character, your approach, will always be external. Your sixth character will be your method, articulatory raising. Now, they're talking about joints when you say articulatory. Fascial release, general mobilization, high velocity, low amplitude, indirect, low velocity, high amplitude, lymphatic pump, muscle energy isometric, muscle energy isotonic, and other methods. And your seventh character is Z, none, always Z. All right, coders, let's go ahead and take a closer look at that root operation treatment. Here it is. Root operation treatment is manual treatment to eliminate or alleviate somatic dysfunction and related disorders. All right, coders, let's go ahead and let's solve our scenarios. Isotonic muscle energy treatment, right leg. So we know that the root operation is the treatment, but do you know the type of treatment it is? If you said osteopathic treatment, outstanding. And you know what, coders? That is the term we're going to look up. Osteopathic treatment of what? This is muscle energy treatment, right leg. So where are we going? Extremity, lower. And it takes us to code 7W06X. And we go to the 7W0 table. And this is the table for osteopathic, anatomical regions, and treatment. And don't forget, treatment is the manual treatment to eliminate or alleviate somatic dysfunction and related disorders. All right, our fourth character body region is 6, lower extremities. Our fifth character will always be external. Our sixth character, go ahead, coders, go ahead and take a peek and kind of guess what the sixth character will be. If you look at your documentation, you will get some clues. And if you said 8, muscle energy isotonic, outstanding. Your seventh character is Z, and your answer 7W06X8Z. Now, how many of you got that correct? How'd you do, coders? Outstanding. Good job. I know you did well. All right. If I sound like I'm fading, I am, but I'm going to keep going, coders. We have 2 more, so I need you to come with me. I'll pick up the pace just a bit. All right. Low velocity, high amplitude, osteopathic treatment of the head. All right, coders, what is the root operation? We know it's treatment. What type of treatment? Osteopathic treatment. We're going to look up osteopathic treatment in the alphabetic index. Osteopathic treatment of what? Head. Our code 7W00X. Let's go find the corresponding table. 7W0, that's osteopathic, anatomical regions, and treatment. And our 4th character is 0 for head. Our 5th is X for external. And coders, I'm going to let you tell me what the 6th character is. Go ahead and scream it. Yeah, I can hear you, coders. I can hear you. And if you said low velocity, high amplitude, outstanding. And our 7th character is Z, and the code 7W00X5Z. So how are you, coders? Are you ready for the next section? Let's do it. Section 8. That's not an 8, but it's okay. We're going to keep going. Pretend that's an 8. And this is for other procedures. Yes, other procedures. Let's take a look and see what these other procedures are going to be. We know that the first character is section. The second is body or device system. Third is root operation. 4th, body region. 5th will be your approach. 6th will be your method. And 7th, your qualifier. All right, let's kind of figure out what are other procedures. What is the definition? Before we do that, let's make sure we're in the correct section. Sorry about that. We're in section 8, and this is 8. Our second character is our body system, and we've got 2 indwelling devices and physiological systems and anatomical regions. So other procedures are defined as things that contains codes for medical and surgical related procedures not included in the other medical and surgical related section. So if it didn't fit anywhere else, you find it here. An example, suture removal of right arm. Yeah, that's pretty straightforward. So let's take a look at our third characters for indwelling devices. The third character will be other procedures. And so will it. It's the same for your physiological systems and anatomical regions. Your body regions for indwelling devices. Your character 4 is your nervous system, your circulatory system. Your 5th character is external. That approach will be external for indwelling devices. Your method will be collection. That's the value 6. For your 7th character, your values will be J, K, and L. Cerebral spinal fluid, blood, other fluid, respectively. All right, now let's take a look at the physical systems and anatomical regions. For your body region, you've got your nervous system, circulatory system, head and neck region, integumentary system and breast, musculoskeletal system, female reproductive system, male reproductive system, trunk region, upper extremity, lower extremity, and none. Your approach, you've got 6 approaches. Open, percutaneous endoscopic, via natural or artificial opening, via natural or artificial opening endoscopic, and external. Your 6th character, method, acupuncture, therapeutic massage, collection, computer-assisted procedure, robotic-assisted procedure, near-infrared spectroscopy, other method. And your 7th character will be anesthesia, in vitro fertilization, breast milk, sperm, yoga therapy, meditation, isolation, examination, suture removal, piercing prostate rectum with fluoroscopy, with computerized tomography, with magnetic resonance imaging, and Z, no qualifier. All right, coders, let's take a look at our root operation, other procedures. These are methodologies which attempt to remediate or cure a disorder or disease. That's the definition, not elsewhere classifiable. Yeah, if it's nowhere else, you may just find it here. Root operations for other procedures. Now, let's go ahead and let's do a few exercises. Near infrared spectroscopy of leg vessels. What is your root operation? Take a guess, coders. What do you think your root operation is going to be? Other procedures? That's a good guess, but you know what it is? Your main procedure, spectroscopy. Yeah, so don't be afraid to look up the procedure. If you don't know where to look up the main procedure anytime. There you go. So we're going to look up spectroscopy of what? Near infrared. And it takes you to code 8E023DZ. And you know what? That corresponding table, 8E0, other procedures, physiological systems and anatomical regions, other procedures. And what is our 4th character? Our code says that it's 2, and it is circulatory system. The 4th character, is our 4th character. Our 5th character is what? It's percutaneous. How do we know that? Well, we don't. Our 6th character is near infrared spectroscopy, and our 7th character is no qualifier. All right. Okay, coders, our final answer, 8E023DZ. How'd you do, coders? Did you get it correct? I know you did. Outstanding. But you know what, coders? If you learned something, that is priceless. And I think that's the first time I've said this, but you know what? It's true.
Thank you for watching an AMCI exclusive presentation in partnership with AAPC. Until next time.